There is one small muscle on the outside of your hip that, when weak, allows your pelvis to drop with every single step you take, putting direct strain on the structures around your sciatic nerve. Tonight, I am showing you one exercise that strengthens that exact muscle using nothing more than a small ball, plus a second movement that gently rotates your lower spine to ease pressure on the nerve root itself. Two exercises, two common mistakes that quietly cancel out the benefit of each, walked through together so you get both right the first time, along with exactly why each one works and how to know if you are doing them correctly. Stay with me, because the muscle we are talking about tonight is one that almost no sciatica routine ever properly addresses. My name is Dr. Michael Kent. 20 years working with seniors managing sciatica. Drop a comment below right now, your age and your city. I read every single one personally. Now let us get completely into this. The muscle most sciatica routines completely ignore. There is a muscle on the side of your hip called the glute medius. Most people have never heard of it, and almost nobody thinks about it when they think about sciatica, yet it plays a critical role in how much strain your lower back and your piriformis experience every single day. Here is its job. Every time you take a step, stand on one leg even briefly, or shift your weight while walking, your pelvis wants to drop on the side where your foot is lifted off the ground. The glute medius on your standing leg is responsible for contracting to hold your pelvis level during that moment, preventing that drop. When this muscle is strong, this happens automatically hundreds of times a day without you ever noticing it. When this muscle is weak, which becomes increasingly common with age, with prolonged sitting, and simply with a less active lifestyle over the years, your pelvis drops slightly on one side with every single step you take. That drop might only be a small number of degrees, but it happens with every stride, all day, every day. Over months and years, that repetitive, uneven motion creates ongoing strain through your lower back as it works to compensate for the instability above your legs, and it places repetitive overload on your piriformis muscle, which sits in the deep hip and runs directly over your sciatic nerve. This is one of the most overlooked contributing factors in chronic sciatica. Most routines focus entirely on stretching the piriformis once it becomes tight and irritated, which is reasonable and helpful, but very few routines ever ask the more important question, which is why the piriformis became so overworked and tight in the first place. In a meaningful number of cases, the answer traces back to this exact muscle, quietly underperforming with every step for years. Strengthening the glute medius does not replace the stretches you have learned on this channel before. It addresses a different, earlier link in the chain, reducing how much ongoing strain reaches your piriformis and your lower back in the first place, rather than only managing the tightness after it has already developed. Exercise 1, the ball squeeze clamshell. Here is exactly how to do this correctly. Lie down on your side on a comfortable but reasonably firm surface, such as a mat on the floor or a firm bed. Stack your hips directly on top of each other and bend both your hips and your knees to roughly a 45-degree angle, so your legs are folded in front of you, similar to a relaxed seated position lying on your side. Your head can rest on your lower arm or on a small pillow, whichever feels more comfortable and stable. Take a small ball, roughly the size of a soccer ball, or a little smaller if that is what you have available, and place it between your knees. The ball should sit snugly enough that you have to apply a small amount of inward pressure to keep it in place throughout the movement. Keeping your feet touching each other the entire time, slowly lift your top knee upward away from your bottom knee like opening a clamshell. As you do this, keep gently pressing into the ball with both knees throughout the entire lift. Lift only as high as you can while keeping everything controlled and stable, typically not very high at all, often just a few inches. Hold briefly at the top, then lower slowly back down with control. That full movement up and down counts as one repetition. Complete 10 controlled repetitions on this side, then roll over and repeat 10 repetitions on the other side, even if your sciatica only affects one leg. Since both sides benefit from this stabilizing work and an imbalance between the two sides is often part of the underlying problem, the ball is doing something specific here that an exercise without it does not achieve as effectively. It gives your inner and outer hip muscles something active to press into and stabilize against throughout the entire range of motion. rather than your legs simply lifting through empty space with nothing to engage against. This constant, gentle resistance is part of what makes this version of the exercise more effective at actually activating the glute medius rather than allowing other muscles to take over the movement. The mistake that quietly cancels this exercise. The single most common mistake, and the one that turns this exercise from genuinely useful into almost pointless, is allowing your hips to roll backward as you lift your top knee. When your top hip rolls back even slightly, the movement stops being primarily generated by the glute medius and instead becomes a rotation through your lower back and pelvis, with your hip flexors and back muscles doing much of the work that your glute medius should be doing. Here is how to know if this is happening to you. Imagine there is a flat wall directly behind your back the entire time you are doing this exercise. Your hips should stay stacked as if pressed lightly against that imaginary wall with no backward rolling at any point during the lift. If you find that you can only lift your knee a small amount while keeping your hips perfectly stacked, that smaller range of motion is exactly correct, and it is far more valuable than a larger lift performed with rolled, unstable hips. A second related version of this same mistake is rushing through the repetitions quickly, using momentum to swing the leg up rather than slow, controlled muscle contraction to lift it. Each repetition should take about 3 to 4 seconds to lift, a brief pause at the top, and another 3 to 4 seconds to lower. If you are completing 10 repetitions in under 20 seconds total, you are almost certainly moving too quickly to be effectively targeting the muscle we are trying to strengthen. Exercise 2, the lumbar rotation stretch. Here is exactly how to do this correctly. Lie flat on your back on a comfortable, reasonably firm surface. Bend both of your knees and place your feet flat on the surface, keeping your knees pressed together and touching each other for the entire exercise. Let your arms rest out to your sides, palms facing down, in a position similar to a gentle T shape, which will help you keep your upper body stable and grounded throughout the movement. Keeping your knees together as one unit, slowly let them rotate to one side, allowing them to lower toward the surface as far as feels comfortable, while simultaneously keeping both of your shoulders pressed flat against the surface beneath you. Hold this rotated position for about 20 seconds, breathing slowly and naturally rather than holding your breath. Slowly and with control, bring your knees back through the center position, then continue the rotation to the opposite side, again lowering only as far as is comfortable while keeping both shoulders completely flat. Hold this side for 20 seconds as well. That full sequence, one rotation to each side, counts as one complete round. Repeat this full round 3 times, so you will rotate to each side a total of 3 times by the time you finish. This gentle, controlled rotation creates a small amount of beneficial motion through the joints of your lower spine, the same joints where your nerve roots exit on their way to forming your sciatic nerve. Unlike forceful twisting, which can aggravate an already sensitive nerve, this slow and limited rotation is designed specifically to ease tension and encourage gentle movement without ever pushing into a forceful or painful range. The mistake that quietly cancels. This exercise. The most common mistake with this movement is allowing one or both shoulders to lift up off the surface as the knees rotate further to one side. When a shoulder lifts, the rotation you are creating shifts away from your lower spine where you want the gentle movement to happen, and instead happens through your upper back and shoulder area, which does very little for your sciatic nerve and can occasionally create unwanted strain somewhere else entirely. To avoid this, only allow your knees to rotate as far as they can go while both of your shoulders remain completely flat and grounded against the surface beneath you. If keeping both shoulders flat means your knees can only rotate a small distance before you feel resistance, that smaller shoulder grounded range of motion is exactly what you want. It can be tempting to force a deeper, more dramatic-looking rotation by allowing the shoulders to lift, but doing so removes most of the actual benefit to your lower spine and defeats the purpose of the exercise entirely. A second, smaller version of this mistake is moving too quickly between sides, treating this like a fast warm-up movement rather than a slow, sustained stretch. The value here comes specifically from the sustained 20-second hold on each side, which allows the soft tissue and joints around your lower spine time to gradually ease rather than from quick repeated movement back and forth. Putting both exercises together. These two exercises were chosen specifically because they complement each other rather than duplicating the same benefit. The ball squeeze clamshell builds the pelvic and hip stability that reduces the day-to-day strain reaching your lower back and piriformis with every step you take. The lumbar rotation stretch works directly on your spine itself, gently easing tension around the nerve roots through controlled, limited motion. One builds long-term stability, the other provides more immediate, gentle relief at the level of the spine. Doing both together once a day addresses two genuinely separate contributing factors in the same short routine. Many people find the evening convenient for this combination, particularly after a day spent sitting or standing, since it allows the body to settle into a more relaxed state heading into sleep. Mornings work well too, particularly for people whose sciatica tends to feel stiffest first thing after waking. Give yourself a minimum of 2 to 3 full weeks of consistent daily practice before expecting to notice a meaningful change from the ball squeeze clamshell specifically, since meaningfully strengthening a stabilizer muscle that has been underused for years takes longer than a single stretching session ever could. The lumbar rotation stretch, by contrast, often produces a more immediate sense of ease in the lower back within the same session, though its benefits also accumulate further with consistent daily use over time. A simple way to track your progress with the ball squeeze specifically is to notice whether you can complete all 10 repetitions on each side while keeping your hips perfectly stacked, without that backward rolling mistake we discussed earlier. In the beginning, many people can only manage a few repetitions with proper form before their hips begin to roll. As the muscle strengthens over those first 2 to 3 weeks, maintaining that proper stacked position for the full 10 repetitions becomes noticeably easier, which is a meaningful sign that the muscle is genuinely getting stronger rather than simply becoming more practiced at a compensating pattern. This is general educational information. If you have had recent hip or spine surgery, or you have any condition affecting joint stability, please check with your doctor before attempting either of these exercises. Stop immediately if you feel sharp pain, increased numbness, or any new weakness at any point, and seek medical attention promptly if that occurs. Drop a comment and let me know which of these two felt more challenging for you, the ball squeeze or the rotation stretch. Subscribe and turn on notifications for more techniques like this every single week. This video is for educational and informational purposes only. It is not intended to diagnose, treat, cure, or prevent any disease or medical condition. Those with recent hip or spine surgery or conditions affecting joint stability should consult their healthcare provider before attempting these exercises. Stop immediately if you experience sharp pain, increased numbness, or new weakness, and seek medical attention. Individual results vary. Dr. Michael Kent is a senior health educator with 20 years of experience, not a licensed physician. Viewer discretion advised.